Welcome to Montgomery Heart Wellness, and we're here today with Clinical Rounds Special Edition. Clinical Rounds Special Edition is a special segment of Clinical Rounds where we will talk about patients that we're actively treating. So today I'm going to talk about a patient that we started working with 4 weeks ago. She's a 79-year-old lady who's had a heart attack in the past. She had a stent placed a number of years ago. She's plagued with hypertension, diabetes, and obesity. And so she came in on a number of medications with high blood sugars. She was on insulin, and she wanted to improve her health. She was fatigued, had some windedness when she exerted herself. So essentially my first step was to start on a raw detox regimen. Her daughter worked very well with her to comply with this regimen. And every week for the first 2 weeks, we followed her closely. We got her essentially off the insulin after about 3 weeks. She was on PRN, or as needed dose insulin, for only if the blood sugar went above 200. So she only had to take the insulin on 2 occasions in the last 2 or 3 weeks. So now she's here today. She's doing much better. We're going to discontinue 2 more medications, the aspirin and clopidogrel. I'm going to start her on a supplement called serapeptase. She was on the clopidogrel a number of years ago because she had the stent placed. Because it's been more than a year, she doesn't need this anymore. So she's actually doing much better. She's off the insulin. She's lost over 23 pounds. Her blood pressure, while it's still elevated in the office, the systolic pressures come down by about 36 millimeters of mercury. The diastolic blood pressure come down by about 20 millimeters of mercury. Her blood pressures at home are normal to low normal. And so we've actually had to stop one of her antihypertensive medications. So while she's not completely out of the woods yet, she continues to improve, and we're going to update you on her progress. So stay tuned for the next part of this Clinical Round Special Edition as I give you follow-up as we follow this patient through our clinic, and you'll also hear directly from her.
My name is Dorothy, and the reason why I'm here is because I was told that my eyes was going into glaucoma, and I knew I didn't want to go blind. And my son told me to come to his doctor, which is Dr. Montgomery. And plus I'm on all this medication, especially with the insulin. And I can't even get my insulin anymore. I had to wait over 2 or 3 months just to get 1 bottle. And it took so long coming in. So I said, well, Lord, I better try to get myself together. And I started praying and fasting and talking to Most High. I knew He was my answer. So that is why I'm here, to get my body together. He put me on a plant-based eating habit. So now I'm not eating meat for sure. And I've been eating raw veggies. And at first I thought it was going to be hard. But through the grace of God, I've been able to succeed. The results has been I've lost 20 pounds within a short time, because I'm supposed to be on this for at least 28 days. And yesterday was my 28th day. And I'm still on it. I haven't eaten any meat, and I haven't did any sweets. And wow, I love my sweets. But I had to give it all up. So I'm very thankful. And I do know God worked miracles. After these 28 days right now, I feel energetic. Well, I'm not on the medication now. And I think that is a blessing, to not to have to take medicine in the morning, afternoon, and at night. And then they keep doubling up on my medication. So now, I feel great.
Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next